You are listening to part 94 of our series, 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Thank you so much, Gemini. I'm hoping that the next time anybody who's been listening to this show has surgery, that they will at least remember that there are things they could do both before and after for themselves, even if they don't remember anything specific. Just remembering that you can help yourself, I think, is a very important part of it. So let's talk about anesthesia. Anesthesias control pain by using medicines called anesthetics. Anesthetics affect breathing. We just talked about that, didn't we? Blood pressure, blood flow, heart rate, and heart rhythm. We were just saying, your lungs and your heart are really going to be affected by the anesthesias. In general, anesthesias are used for a variety of reasons. They can relax muscles. They can block the sensation of pain. They can induce sleep. They can blunt the stress response. They can inhibit consciousness. They can cause amnesia, and they decrease surgical mortality. It's hard for any of us to conceive of surgery being done without anesthesia. For us, they are the horse and the cart that go together. You're going to have surgery, you're going to have some kind of anesthesia. Anesthesias include analgesics, which relieve or prevent pain, paralytics, which relax your muscles so much that you can't move, amnesiacs, which cause you to forget, knockouts, which render you completely unconscious, hypnotics, which cause you to fall into a deep sleep, sedatives, which counter agitation, and neuromuscular blocking drugs, which block pain, sensation, and often the ability to move. And, of course, the narcotics, which do almost all of the above. The ideal anesthesia, the ideal anesthetic, would provide hypnosis, amnesia, analgesia, and muscle relaxation without changing blood pressure, pulse, or breathing. We do not have that ideal anesthesia. And this is why the anesthesiologist is truly the person who is holding our life in their hands when we are having surgery. Surgery was done for thousands of years with little or no anesthesia. We have records of surgery being done all the way back to dynastic Egypt, thousands of years ago. And although they certainly understood Poppy and could give a Poppy, the surgery was often done with the person fully conscious. Even as close to us as the Civil War, amputations were done without anesthesia. The stress response can indeed kill in that situation. And even with anesthesias, it is sometimes happens that surgery does cause a stress response. I also want to mention here, before we get into more specifics, that anesthesias affect men and women differently, and that we do not know a whole lot about those effects and how they are caused. What we do know is that more women than men report that they were conscious during surgery, although they could not speak. In other words, the anesthesias that inhibit consciousness especially do not seem to work as well for women, although the ones that relax the muscles, that are paralytics, seem to work just fine, perhaps even better. This can cause a very heightened stress response, when the person realizes that nobody knows they're conscious, and they can't move. It's rather like that. We've all had that dream where you still have enough sleep stuff in your brain that you can't move, but not enough sleep stuff to keep you from being semi-conscious. And it's the same kind of thing. You literally can't move a muscle. So if you're a woman, talk anesthesia. Talk with your anesthesiologist and ask if they're onto the fact that women react differently and what different anesthesias they use because of that. So let's look at some anesthesias. There are certainly a lot of different types that we use nowadays. First of all, local anesthesia, which simply numbs a small part of the body for a minor procedure. And you're usually awake for that. For instance, the vast majority of people have had local anesthesia to have a cavity filled in their mouth. Yes, that's the doctor with that needle who's poking it into your gum, and then you can't feel anything. That's a local anesthesia that actually blocks not just pain, but all sensation to that area. I've actually found that the pain of the injection and the pain of the anesthesia wearing off bothered me far worse than the very, very minor pain of having the cavity filled. And it took me a bit of time to convince my dentist, and I had to take some relaxing herbs for the dentist. But in fact, the dentist is now perfectly fine and knows that I am feeling less pain than I would if I had been injected with local anesthesia. Certainly, if there's going to be a surgery where there's an actual scalpel, the doctors very much like to use anesthesia because it slows bleeding. When I had to have a small surgery done on my gum, I had a big argument with the dentist because I didn't want the local anesthesia, and he wanted me to have it because he was afraid of bleeding. And I told him that I had used yarrow tincture on the area and gave him the bottle of yarrow tincture and said that he could use it as liberally as he wanted. And he kind of, looked cross-eyed at me, but finally, gave in and did it. And I said, look, if I'm like bleeding gouts of blood and it's dripping down, then we can stop and you can use the anesthesia. But in fact, I didn't. And afterwards, he asked me a lot about the herb because he said the bleeding control was as good as it would have been with the anesthetic that he would have used. Regional anesthesia blocks transmission of nerve impulses between the brain and a specific part of the body. Like local anesthesia, there is loss of sensation, but consciousness is preserved. And regional anesthesias are often combined with other anesthetics which can induce relaxation, paralytics, and sleep, to induce sleep hypnotics. Regional anesthesia is broken up into peripheral nerve blocks and central neuraxial anesthesias. The peripheral nerve block is anesthetics which are injected in or around a specific nerve or group of nerves. Peripheral nerve blocks are used for root canals, hernia repair, stent placement, procedures involving the limbs or the face. Often they're used for brain surgery because the patient needs to be alert and conscious for brain surgery. Peripheral nerve blocks generally avoid most of the major side effects of anesthesia. Very unlikely to have a blood clot or to be followed by pneumonia or heart distress when we are simply using a regional anesthesia. But when I had regional anesthesia for my hernia repair, nonetheless, my body reacted to that anesthesia by starting to shut down. My blood pressure dropped very, very, very low, and I was glad that I was conscious because I could hear the surgical staff starting to freak out, and I was able to say to them, "It's going to be okay. I know how to cope with this. Just give me a minute." And they were so shocked that I knew what they were talking about and what was going on, and I was able to get everything turned back on and my blood pressure to come back up, and they were able to continue on with the surgery. Central neuraxial anesthesia is the injection of local anesthetics around the spinal cord. This provides analgesia in the abdomen, the pelvis, and the lower extremities. This causes arterial vasodilation, so big drops in blood pressure are quite common. And that's what I was saying happened to me from the peripheral nerve block. And this drop in blood pressure is usually dictated by the venous side of the circulatory system, which holds about 75% of the circulating blood. And these effects are much greater when the block is placed above the fifth thoracic vertebrae. There are three types of central neuraxial anesthesia: spinal, epidural, and caudal. The spinal injects the anesthetic into the subarachnoid space of the spine. Epidural injects it outside that space and into the epidural space, and caudal is an injection into the tail end, the cauda of the spinal cord. Spinal anesthesia is a one-shot injection that provides rapid onset and profound sensory anesthesia with low doses of anesthetic, and there is usually loss of muscle control. Epidural anesthesia uses larger doses of anesthetic infused through an indwelling catheter, which allows the anesthetic to be augmented if the effects dissipate. And typically, epidural does not affect muscle control. Epidurals, of course, are used for cesarean sections and can also be used during labor and delivery if there is a lot of pain. Many midwives, of course, believe that epidurals are quite overused, and I would tend to agree with that. There's a lot of other ways besides an injection of anesthetic to deal with the pain of childbirth, although it can be quite extreme. Sedation, which is dissociative anesthesia or twilight anesthesia, suppresses the entire central nervous system, but to a lesser degree than general anesthesia. Consciousness is retained. Sedation creates hypnotic, sedative, amnesiac, anticonvulsant, and centrally produced muscle-relaxing effects. Sedation inhibits anxiety and helps prevent traumatic memory formation. Most of the time, patients are sedated before the anesthesias are used. Again, when I had my hernia repaired, they came around, it seemed to me like about an hour before we were taken into the waiting room for the surgery, and offered all of us sedatives. I refused the sedative. I said, I'm just fine. I do not need a sedative at all. And in fact, I had told a great many people that I was having surgery to repair my hernia and that I wanted their loving support. And when I woke up that morning, I was again, symbolically, emotionally, surrounded by that circle of friends. I could feel them. I could feel their love pouring into me. It was like a being. There was so much love around me. I was almost giddy with it. I was nearly laughing with the amount of loving care that was coming into me. As a matter of fact, they had a young man there who was having his hernia repaired, and no matter what sedative they gave him, and I saw them give him several, he was just a bundle of nerves. And finally, I guess in a last-ditch attempt to calm him down, they brought him and set him down right next to me, and sure enough, within 5 minutes, he was feeling that wonderful, loving glow from all of my friends, and we were joking around, and he did not need a sedative either. Sedation inhibits anxiety, and the advantage over general anesthetic is it does not require intubation of the airway, no mechanical ventilation, and it has less of an effect on the cardiovascular system, and this adds a much greater margin of safety. General anesthesia is the strongest anesthesia, and it suppresses central nervous system activity, resulting in unconsciousness, total lack of sensation, often amnesia, no sensation of pain. Some general anesthetics are given as an intravenous infusion, and others are inhaled. And when we are talking about side effects from anesthesia, it is the general anesthesia, of course, that has the greatest side effects, the greatest possibility of actually killing someone. Yes, we are at the seventh medicine. We remember that there are 7 medicines, and they are set up in order of risk. Medicine number 1 has little or no risk. The 6 medicines and the 7th medicines, we are in high risk area. Sometimes when we take drugs or use high-tech medicine, we can die as a result of the treatment. Yeah, maybe what we had wouldn't kill us, but sometimes the treatment can, and anesthesia is one of those things. Certainly not everybody. The type of anesthesia that's used for your surgery is going to depend on what? It's going to depend on your personal reactions to anesthesia. It's going to depend on your past and current health, with, of course, a special focus on heart or lung problems. The type of anesthesia used is going to depend on your age. It's going to depend on the type of surgery you're having. It's going to depend on the results of blood tests and electrocardiograms. It's going to depend on your doctor's preference, and it's going to depend on your ASA physical status classification. Now, remember that I mentioned that different anesthesias affect men and women differently, and I found it very interesting that none of the references I consulted said that the type of anesthesia used would depend on whether you're a man or a woman. So that's one of those questions and statements that you're going to have to pick up on and protect yourself. All right, I bet you're wondering what your ASA physical status is. And that's just a way of the American Surgical Association Physical Status Classification System. Class 1 is a healthy person. Class 2 is a person with mild systemic disease. That might be diabetes, hypertension, something like that. Class 3 is severe systemic disease. Class 4 is severe systemic disease that is a threat to life. And when I read that, I thought, what could that be? And then I immediately thought, oh, diabetes. Diabetes is a severe systemic disease that is an actual threat to life. If you don't take your insulin, if you don't watch out what you're doing, then you could actually die from diabetes. ASA5 is a moribund person who is not expected to survive without surgery. In other words, this is a person who is very, very sick. And ideally, we would not operate on this person. But unless we operate on this person, they're certainly going to die. And while it's a pretty big chance that they will die from the surgery, it's a bigger chance that they'll die without it. So we're going to do it. ASA6 is a declared brain dead person whose organs are being removed for donor purposes. Interesting. So different anesthesias are used if you are already dead before the surgery. And E is a suffix added to ASA 1, 2, 3, 4, 5, or 6 for patients undergoing emergency procedures. Let's look at some of the specific risks and complications, although we have talked about them a bit. After general anesthesia, heart problems, pneumonia, sore throat, delirium, and vomiting. Ugh. If the dose is high enough, a local anesthetic can actually affect the brain or the heart. After spinal anesthesia, some people get headaches. If you have heart disease or lung disease, it is going to strongly increase your chances of having side effects after the anesthesia. We are back to smoking, drinking alcohol, and using illegal drugs. That's also going to increase your risk of post-surgical problems. The major risks and minor risks of anesthesia. Major risks: death, heart attack, and a pulmonary embolism, which could kill you. Minor risks: nausea, vomiting, delirium, cold, shivery. The likelihood of complications is affected by the length and complexity of the surgery, the types of anesthesias used, and the patients. And what has the greatest bearing of all on the likelihood of complications is the person's health prior to surgery. Remember that prehab we were talking about before surgery? Here it is again. Very, very important. Patients typically wake within minutes of an anesthetic being terminated and regain their senses within hours, but some effects may last much longer. I was very surprised after my hernia repair when I tried to get out of bed and walk to the bathroom that my legs felt like rubber. The anesthesia, although it wasn't injected into my legs, nonetheless had gotten there, and I was like a little Gumby there trying to get to the bathroom. Long-term post-operative cognitive dysfunction, characterized by persistent confusion, which can last for weeks or even months, is more common after cardiac surgery and after any surgery in the elderly. You know, Jim and I don't mind being an elder, but I certainly don't like that word elderly, especially when it is applied to me. So it is the elders who are more likely to have cognitive dysfunction. And, of course, ginkgo is a wonderful herb to help prevent that cognitive dysfunction before and after surgery. Ginkgo is pretty safe herb taken, especially in tincture form, and you can start taking it before the surgery. I know. It's one of those on the list of don't take this before surgery because it thins the blood. I have talked with a surgeon who knows a lot about herbs, and he tells me that he doesn't think there's any herb that is going to increase the risk of bleeding. And he lets the patients that he operates on take all of their herbs, any herb that they want, right up until the day of surgery. So you'll have to decide for yourself about the ginkgo. Some people have numbness or less feeling in the part of the body where the anesthetic was for a long time. I didn't have sensation in the area where they injected the anesthetic for my hernia repair for weeks. And it was okay because I could tell that it was going to come back. But I am affected very, very strongly by such things. Muscle control and coordination may be affected both over the short term and over the long term. And again, the less well you are before the anesthesia, the more likely these kinds of side effects are to happen. Malignant hyperthermia is very, very, very rare, but it does occur as a reaction to anesthesia, and what that means is that the person gets so hot that they can die, and there's a specific drug, dantrolene, which is used to counter it. If you're going to have outpatient surgery, you might want to just ask if they actually stock dantrolene in case you go into malignant hyperthermia. It's estimated that about 22% of people dream during surgery, and that about 2 cases per 1,000 have what I was talking about at the beginning of the show, consciousness during general anesthesia. Those things that I've been talking about, the blood pressure lowering, and that's called a crash. When I talked about when my body started to shut down, my blood pressure dropped. My upper number was 40. And there should be a crash cart on hand. That's what the staff was starting to talk about. Should we get the crash cart for her? Which I said, just wait a minute, I'll be able to bring it up. If you're going to have any procedure and there's not a crash cart on hand, you are risking it. Even if it seems like a safe procedure, people, yes, have died from something as safe as liposuction. People, yes, have died from something that seems very safe. We don't know how our individual bodies are going to react to these very powerful medicines. Modern medicine is constantly changing, and here's the biggest change that's going down right today. The best doctors in the world are always wanting to improve patient comfort and outcome, and the guidelines surrounding fasting before surgery are one of those areas where these best doctors got in and said, you know what? I don't think we're doing this right. In many instances, and certainly when I had my hernia repaired, nothing by mouth, NPO, after midnight has been the standard. 50% of the anesthesiologists belonging to the American Society of Anesthesiologists concur that it is safe to have clear liquids up to 2 hours prior to surgery. A sip of juice or infusion will rev up your metabolism, soothe your stomach, and calm your nerves the morning of the procedure. So if your doctor is saying you can't have anything to eat for hours and hours before the surgery, check in with the doctor and see if that's really what they think, and say, hey, Susan said that the American Society of Anesthesiologists, at least half of those, think that I can have something to drink. Ask your doctor to look at the regular medications that you take. I've been very surprised that stent procedures are done with people on blood thinning drugs. That's not considered a problem. But if there was to be open surgery, they probably wouldn't want that blood thinning drug being taken. Stay calm. Mental relaxation, guided imagery, meditation. Invite your guardian angel. Plan to go home, not by yourself. No. It is not recommended to drive yourself after anesthesia. Again, the effects can linger. Get somebody else to drive you home, especially if it's an outpatient procedure. Choose your anesthesiologist. Again, this is one of the most important aspects of having surgery. And so we are going to come back next week, and we are going to talk about choosing the anesthesiologist, what to look for in an anesthesiologist, and some more tips from the anesthesiologists themselves about how we can recover from anesthesia. Thanks for having me on the show, Gemini. It is such a delight to have your support and the support of Time Monk Radio for my reweaving of the healing cloak of the ancients and my reviving herbal medicine as the medicine of the people. Yes, herbal medicine is people's medicine. The green blessings of herbal medicine are everywhere. They're right outside your door, too.
Thank you so much, Susan. It's always our pleasure to have you join us at Time Monk Radio. And this concludes part 94 of our series, The 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio.